as practitioners, we can't see what is going on inside in your biochemistry. So we're getting things like food intolerance, nutrient panels, a gut health assessment, exact data to know how to heal your imbalances, and then typically the weight will start to just fall off naturally. The body wants to heal itself.
Welcome back. You are watching the Dr. Nandi Show, and losing weight is really much more than just picking a diet and trying to stick to it. My next guest is a functional medicine nurse practitioner, and she has a different approach to losing weight in a healthy manner. Please welcome Maggie Berghoff to the show. Thank you so much.
Thank you so much for having me.
Of course. And Maggie, what the heck is functional medicine? So people are watching like, what the heck is that?
Yeah, so essentially I've combined my practice of traditional medicine with that of more a natural, deep root cause approach to healing the body. So we're looking deeper into the body, really getting to know what's going on inside of you so that we can curate a perfect plan for your healing process.
That's awesome. So, the idea is that when we went to medical school, we were told, okay, so somebody comes in with this problem, you take this medicine or this procedure and you fix it. That's traditionally been what medical training has been about, right? And I'm sure the same way for you. This is a little different. This is going to the root cause and saying, let's find out what causes things and let's go backwards. And so what do you recommend the first step when people want to lose weight? I like to say when they want a healthy weight and then stay at that weight. What are the first steps that you recommend for your patients?
Well, the first thing I recommend is to get some testing done to understand what's going on inside of your body. We don't know, and even as practitioners, we can't see what is going on inside in your biochemistry. So we're getting things like food intolerance, nutrient panels, a gut health assessment, exact data to know how to heal your imbalances, and then typically the weight will start to just fall off naturally. The body wants to heal itself.
That's an amazing statement. The body wants to heal itself. I often tell my patients, every cell in your body has really one goal. It's to help you thrive and help you survive. And so all you have to do is really get out of its way, right? We've introduced so many things that the body cannot handle. So we're talking about environmental toxins, foods that are terrible, these little devices that we carry all around us, those nice little phones that you got your head looking down at, even while you're probably watching the show. All those things can really play a difference. But let's talk about diet. All these fad diet trends, and I'm calling it fad because tomorrow they may not be there. We're talking about keto. We're talking about paleo. We're talking about intermittent fasting. Talk to us about those diets and why you think they're not effective.
Yeah, so the diet that's right for you is the one that addresses your internal imbalances. I say that over and over and over again.
Yes.
And the reason why these trendy diets are not effective is because it could be causing your body more damage, which in turn is going to cause more symptoms down the road, just covering them up, like you said, at first, possibly. I've had people also come to me who actually got worse following these diets initially, right off the bat.
Yeah, and so we talk about, there's a whole trend on low carbs, and it's a really tough thing for people to understand. Low carbs, the bad carbs, the simple carbs, right? The simple sugars. If you look in the back of a package, you'll see the added sugars. So an apple has carbohydrates, very different from the jelly bean or the piece of candy or the white bread. So the white bread, the simple carbohydrates, is very different from the complex carbohydrates in fruits and vegetables, and it's really being like, you just have to go low carb and you'll do well. And people do lose weight. I'm not going to lie to you. People do lose weight. But what's happening on the inside, and this is what Maggie specializes in, your gut gets inflamed. And that inflammation can lead to worse health problems over time. So you can't have a steak every single night and think nothing's going to happen. If you have grass-fed beef and you eat small portions intermittently, it's okay. But it doesn't happen. What about women and hormones? These diets and women following them, do you see some problems with that?
Yeah, I do. Chronic dieting and then ending up binge eating or having some kind of eating disorder really imbalances their hormones, their gut health, like you said, microbiome, and also when women and men are eating the same foods every day following a diet. So like you said, eating that steak every day or even eating broccoli every day, your body can create food intolerance to that item, and an item that is previously healthy becomes unhealthy for your body because it inflames to that item.
Yeah, and I'll tell you, the only caveat I'll say is that it will be less problematic to eat broccoli than eating a steak, but she's right. Anything in super excess can be problematic for people. There are people who've eaten salmon every single day and then have had, toxicity, for example, for metals, and so you have to really, the key is that it's bio-individual. And when she talked about getting your blood test, getting your profile, making it individual, and she said a very interesting and amazing statement, the diet or the food plan that's the best for you is the one that's custom made for you and works. It may not be that all those, you may see all the social media Instagram stars, they see that they did this and they're super thin and they look great in this little piece of cloth that they have on, right?
Yeah.
And you know what I'm talking about. You look at that and go, wow, how do I look like that? So that's not the whole story. Inside, your arteries may be getting clogged, your gut may be getting inflamed. So great stuff. Thank you for joining us.
Thanks so much for having me.
Hi everyone, I'm Dr. Partha Nandi, and if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.